Hi, Melissa. Thanks so much for taking time today.
Hi, Maria. Yes, you're welcome. I'm happy to be here.
Now, if you don't already know Melissa, Melissa's going to be teaching one of our new webinars for our Adult and Adolescent series, which is Understanding Eating Disorders in a Digital Age. Melissa, can you tell our listeners a little bit about yourself?
Yes, absolutely. So, my name is Melissa Preston, and I am a licensed professional counselor and a registered dietitian. And I have just around 15 years of experience working with people with eating disorders. Um, and I have owned a private practice specializing in eating disorders since 2013. So yeah, I've been doing this work for a long time. I'm very passionate about it, and I'm so excited to teach others about it in this webinar.
I love that. Yeah, and I was so thankful to get connected with you and your willingness to kind of talk about this. Eating disorders is one of those things that when you're out of program, there's not a lot of, teaching about this in our school days and on our initial programming, and even finding specialty like training on it, it's not always available, but it is a topic that we're seeing more and more of.
Absolutely. Yes, I think it's definitely something that we are seeing so much more of, and especially with, I don't know if I want to even say the rise of social media because we've already risen, um, but just with our extensive use of various forms of social media, I feel like eating disorders, disordered eating, just unhealthy habits is just becoming so much more prevalent,
Yeah.
you know, yeah, for this population. So, yeah.
Absolutely. Yeah, and I think as a whole, our field kind of feels like eating disorders is one of those really complex diagnoses and high risk mental health conditions that well, I know when I was out of school, it was like if you suspect this, you need to refer them out. You are not trained for this. You could do so much damage for this. So I'm
Mm.
wondering for you, do you see that to still be true? Do you find a lot of people kind of reaching out for consultation around this?
I would say, I mean, yes and no. So I think that one thing about eating disorders that feels scary for clinicians that are not trained in it is that, so one is that eating disorders carry the highest mortality rate of any psychiatric diagnosis. And also there, it feels a little bit more complicated because they also present with a lot of significant medical complications, which I think a lot of therapists just don't feel comfortable working with. So I think that is a piece of why a lot of clinicians don't feel comfortable working with it. Um,
Yeah.
but I think that one thing, for clinicians to really know is that, what makes eating disorders so challenging is that they they're not just existing like in isolation, right? It's not just that someone presents with an eating disorder. I think so much more so now than ever, they are intersecting with trauma, anxiety, depression, perfectionism, OCD, and kind of what we're going to really be focusing on now, too, even more so than ever, like the digital culture that we live
Yeah.
in. So,
Yeah.
so yeah, and I just think kind of the landscape of eating disorders with our digital culture is like it's changing how eating disorders, disordered eating, body image issues, it's changing so much of how it's showing up as well.
Yeah, I love that. So I'm wondering, is specific to adolescents and adults clients, are you seeing that it's presenting different too in the clinical space?
Um, as people, you mean as people are showing up like in sessions, is it looking differently?
Yeah. Yeah,
Hmm.
I think most clinicians when we hear eating disorders, at least for my experience and even those that I do consultation with, we think of like anorexia, bulimia, classic textbook, what we were taught to look for kind of
Right.
presentations. With everything that's going on, the world that we're currently living in, and the influence of digital media, do you see that it's more nuanced? Is it showing up differently?
Absolutely. Yes, such a good question, Maria. And yes, it's absolutely showing up so much differently. I would say we're seeing so much more what I would, or what DSM would say, like kind of atypical eating disorders,
Mm.
like they don't fit into a box. And especially just given like all of the digital things that are happening with TikTok and the what I eat in a day, reels and videos.
Yeah.
And I think that people are showing up on different diets or different fitness regimens, and it feels very normalized, right?
Yeah.
Um, as our society very much promotes this. But
Hmm.
underneath it, it's like, oh no, this is really kind of obsessive and this is disordered eating, but it doesn't look like it from the outside at all. And it feels
Right.
completely like normalized and encouraged by our society.
Yeah, absolutely. I mean, you can open up TikTok at any given point and like find those really easily. And we know the algorithm feeds you what you're looking for, so it can be a very slippery slope. Um, when
Absolutely. Yes.
when we're talking about like social media, pop culture, the digital age, clinically speaking, are is that something to consider when looking at someone's possible eating disorder or disordered eating? Are if we don't ask about what they're consuming digitally and in the media, are we missing something if we don't do that?
Oh, absolutely. Because I mean, I think especially, I mean, I'm going to say adolescents, but not just adolescents. We know what, lots of adults are on social media a lot, like
Yeah.
consuming this media. And so, if we don't ask about that, I mean, somebody could be not even actually trying to seek these out, but even just in the ads that are, between the Instagram reels that they're watching from their friends, right? There's
Yeah.
like so many advertisements these days around like ultra processed foods and
Yep.
also, one of the things that's so popular right now is this biohacking, right? So like
Yes.
all of these different things that people are doing to try to, you know, decrease their age or be healthier, and all sorts of things, tracking food, tracking weight, tracking fitness. So these things are just so common these days in social media. And so if we don't ask about it, we're missing a huge piece, I think, of what the client can be consuming and influenced by.
Yeah, and they may not even realize that they're getting that kind of reinforced message over and over again if they're not intending to, right? If it just starts with like one ad, one video, and then there's a couple more, and
Mm.
it just kind of builds on that. Do you see that it does kind of reinforce that eating disorder behavior or disordered eating?
Oh, definitely. Because I mean, we're absolutely like you're saying, it's like it's maintaining these factors, and it's also just like it's reinforcing what the client might already believe around health or fitness or food. And so and I think the other piece too is that it also feels like, well, everybody else is using these things, or using these trackers or tracking their food or on this diet or whatever it is. And so yeah, I mean, it's really just like actively shaping someone's behavior, maybe without even their knowledge, that it's
Yeah.
happening.
Yeah, I love that. I mean, so much of our digital consumption is mindless almost these days. So they may not even be fully aware, but how many times does that ad show up? How many influencers are they following that are promoting the same type of thing? Or, I know
Exactly.
I know fitness gets really shady and kind of leaning towards disordered eating sometimes in the way that they talk about food prep and what they consume in a day and how they kind of qualify their behaviors for that kind of eating.
Exactly, right. I mean, we have so many different types of things like that. There's the what I eat in a day videos, body transformation content. There's like before and after weight loss. And then there's also, I feel like every week there's a new thing that's like, what's the this past summer, right? It was like hot girl summer. Um,
Yeah.
I
Yes.
know. So it's just like, it's never ending. I mean, I think also too, we see so many things online that are this like, kind of like spend a morning with me, right? Day in the
Yep.
life of, right? And it looks like these people are so overly productive. They wake up at 5 a.m. and like they've lived an entire life by the time it gets to 9 a.m. And even that, right, I think is reinforcing that like this is what we need to be doing for health or
Yeah.
fitness, or we consume our greens powder first thing in the morning or whatever it is, right? And it's just kind of like never ending of these things that we feel like we need to be doing.
Yeah, I'm so glad that you're going to be spending some time with us, because I think this is an important conversation to have, and I know again there's just not a lot out there for clinicians, especially navigating the ever-changing landscape of the digital age that we find ourselves. So,
Mhm.
by offering this training, what are you hoping clinicians might think differently about assessing or diagnosing eating disorders or disordered eating?
Yeah. Well, so I'm hoping that, like by the end of the training, that clinicians will be able to think very differently about assessment and diagnosis of eating disorders. Because I think like you said, it's like kind of back in the day, traditionally people think of eating disorders as like weight or BMI, just certain behaviors or like symptoms, right? And so I think by looking at these other things digital consumption patterns and someone's identity or aesthetic alignment, kind of like where do they want to be, where do they feel aligned, their wellness belief systems, um, also looking at like tracking and monitoring behaviors and also their comparison habits. So
Mm,
it's like we're going to be exploring kind of like all of these other pieces that can really lead to disordered eating and how that can show up in the room. So, yeah. So, I mean, I think really too, like, when we're talking about kind of like the media literacy, right? It's
yeah.
not just telling people to get off social media because, like, let's be real, they're not going to, and I
That
get
seems
that.
so unrealistic.
So unrealistic. Yeah, but I think just more so like understanding about like those reinforcement loops that people are watching, and also really like I do a lot of talking about diet culture, which is really just like the culture that all of us live in because diet culture is everywhere.
Everywhere.
And so, yeah, so really kind of being able to understand how that is influencing someone, and also to really like separate health from morality. Like
Mm,
that's a big piece of it because it feels like they're one and the same, right? Like, oh, if you're a good person, you want to be healthy. Um, and that is a really like scary kind of slippery slope that people go down. So yeah,
yeah,
hoping to talk about a lot of those pieces.
I love that. I love that. So, is there maybe like one little takeaway that you can share with people who are thinking about like maybe I'm not sure. I don't know if I even have clients who are struggling with this. Is there maybe a takeaway that you feel like yes, they need to come and here is a little piece of why.
Yeah. Yeah, well, I would say maybe like the biggest takeaway of why I feel like this training is really important. Well, for one, I feel like anybody working with adolescents or young adults, it's going to show up. So there's that piece. Anybody working with anxiety, perfectionism, trauma, or OCD is going to show up. But I think that, if a clinician is unsure of whether this training is relevant or not, I really want people to understand that eating disorders, they look differently than they did 20 years ago.
Yeah.
They're more hidden, they're more normalized, they're completely socially rewarded, and they are like culturally embedded, right? So
Mm.
they're just kind of like happening right in front of us, and we might not even recognize it because it feels so normalized. And it can really be very distressing for clients, right? And we don't even realize like that this is happening for them. And so I think that that is one of the biggest pieces is like just how much it's just a part of our culture and how distressing it can be for someone. So that is, I feel like, who this training is for. So I feel like it's kind of for everyone, but
Yeah.
I know not everybody, wants to learn about it, but I do feel like it's completely culturally, socially relevant for just the society that we live in today.
Yeah, no, I appreciate that. And absolutely, when you were saying that, I just think about even just going to the grocery store, right? Now there is like the protein section with like protein bars and powders, and it's all
Mhm.
very normalized and, boxed up and packaged so pretty. And there is a lot of social reward for, oh, you're doing this diet, you're doing this whatever to be better. Um,
Mhm.
and it can be a very slippery slope between what is healthy and good for me and what is disordered, but feels good because everyone else is praising it.
Exactly. Exactly. And you bring up such a good point, Maria. It's like if you shop at the grocery store, this training is for you.
Yeah.
Because I mean, I just like internally laugh when I go to the grocery store and I see, right, this new protein like section that is just like everything has added protein. Or, the other day I think I read a label, it was like on like frozen vegetables and it said gluten free on it. And I was like, oh my gosh, this is ridiculous. Of course, vegetables are gluten free, but somebody that's not knowledgeable is going to be like, oh, that's great. Well, no, vegetables are already gluten free. Like that doesn't need to be said. So yeah, I mean, it's just that, marketing and just all of this is kind of just has gotten a bit out of control. So
Yeah, no, I appreciate it. And I'm so excited to have you. I know we've got you for a couple hours in March. And then I know you and I have also talked that if this lands really well, that possibly going into even deeper kind of exploring eating disorders for clinicians who do acknowledge that it's showing up for them and they do want some more support and better skills.
absolutely. Yes, I would love to do a more in-depth training, if this one lands well and people want more information. That sounds great.
Excellent. Thank you so much, Melissa. I appreciate your time today.
Yes, thank you, Maria.